Hi ladies, how are you doing? I hope you are doing well and welcome. How is the pregnancy journey taking you? I hope you are enjoying every bit of it. And pregnancy journey can be smooth and also it can be somehow rough, or let's say it can be bumpy because of the hormonal changes during pregnancy. But all in all, what we pray for, all of us, what we want is after 9 months, we all want to receive a baby who is healthy. And yeah, that is all we want. And that is all we wish for every pregnant woman. So today I want to teach you about the danger signs in pregnancy. So that just in case anything happens, you will be aware and you will know what to do, or you will have to rush to the hospital to seek medical attention. Okay, so what is pregnancy? Pregnancy is a time, or it is a period when one or more offsprings grow in a woman's uterus or a woman's womb. That is the definition of pregnancy. And I want to congratulate you all. Congratulations. And I want to wish you well in your journey of pregnancy. And I wish you all the best. I wish all of you safe delivery. And I wish that you all have healthy babies due after a period of 9 months. So today I want you to understand some of the danger signs in pregnancy, so that if you experience one, you just rush to the hospital so that you can seek medical attention. Okay, so number one sign of a danger when you are pregnant is severe headache. Okay, so severe headache in pregnancy is very risky, or it is a danger sign, because actually anytime that you have headache, it means that there's something wrong in your system. But if you have severe headache during pregnancy, you can have headaches, some mild headaches day to day. But if you find out that you have a very severe headache that is not going away even after taking a painkiller, that is a danger sign, and it might mean that your blood pressure is very high and it needs immediate attention. So you are needed to rush to the hospital so that you can be checked for your blood pressure and find out maybe what is the cause of this severe headache that is not going away. Okay, so severe headache is a sign that something is wrong with your blood pressure, and I want you to understand that your blood pressure is very important during pregnancy. It is very important to monitor your pressure, because high blood pressures put your baby at high risk. Okay, you might end up having an intrauterine fetal death. So anytime you experience headache, don't take it for granted. Rush to the hospital for further evaluation. Okay, number two danger sign in pregnancy is visual disturbances. Okay, this means that you notice that you are starting to have blurry vision. Okay, blurred vision during pregnancy can also mean that something is wrong with your blood pressure. Most of the times when blood pressure is high, people experience visual disturbances. So if you notice that you're starting to have visual disturbances, having blurry vision, rush to the hospital for your blood pressure to be checked. Okay. Number 3 sign of a danger sign is dizziness. Okay, or feeling like you want to faint or passing out. If you pass out, that is like if you faint during pregnancy, that is very risky. Okay, because it can mean that your blood pressure is low, or if when you lie down, when lying down on your back, you feel dizzy, that means that this happens mostly when your baby is big during your third trimester, and when the baby presses on the arteries that take blood back to the heart, you can experience dizziness. So you are advised to lie on the side, okay, to avoid such issues. And also, if your blood pressure is low, one of the signs is becoming dizzy or being dizzy. So you are advised to go to the hospital to do a checkup, or maybe you can find that you have a low HB. That is risky because when you are pregnant, this baby that is growing in your womb depends on you. You are the one who supply nutrients to the baby and also oxygen. So if you have a low HB, that means your baby will not get enough supply of oxygen, and that is risky to the baby. And also, if your blood pressure is low, risky to you and also the baby. So at one point, if you become dizzy or you feel like you want to pass out or you faint, just go to the hospital and do a checkup. Okay. We have number 4 sign, severe abdominal pain. If you experience severe abdominal pain during pregnancy, mild pain sometimes in pregnancy is normal because of your baby is growing, your tummy or your uterus is stretching, the muscles are stretching. This one can cause some mild pain, but then if you experience severe abdominal pain during pregnancy, it's very risky because you need to rush to the hospital. Number 1, you might be having an ectopic pregnancy. This means a baby growing outside the uterus. Okay. You might be having a miscarriage. Okay. Before you miscarry, first you experience pain accompanied by some vaginal bleeding. So if you just start having severe abdominal pain, without even experiencing vaginal bleeding, just rush to the hospital. You might be having preterm labor. That means you might be going into labor before you are term or your baby is term. And also you might be having placenta issues. Okay. Maybe the placenta is detaching from the uterus, which is very risky to the baby. Placenta is responsible for exchanging nutrients from the mother to the baby and also oxygen. So if the placenta detaches from the uterus, that means your baby is at a very high risk. If they can't receive oxygen, if they can't receive nutrients, that baby is at a risk of dying in your uterus. So it is risky. And also you might be having a urinary tract infection, a UTI. Also UTIs can manifest through having abdominal pains. And during pregnancy, having a UTI is very risky because the infection can ascend up, actually cause miscarriages. So you have seen how abdominal pains can be so risky, and it is caused by so many things. So once you experience abdominal pain, you have to rush to the hospital for more evaluation. Your doctor will know what to do to know the cause of the pain. If it is an ectopic, if it's a placenta that is detaching, you will need to go for an emergency CS, okay? Because now your baby is not receiving oxygen, not receiving nutrients. You might need an emergency CS to save your baby, okay? Another sign is burning sensation during urination. If you have a burning sensation during urination, is a sign that you might be having a urinary tract infection. And as I have told you, a UTI can ascend, okay, and it can cause a miscarriage. One of the causes of miscarriages is an infection, okay. Another sign is vaginal bleeding. If you experience vaginal bleeding during pregnancy, this is very, very alarming, and you are required to go to the hospital as soon as possible. You might be having a miscarriage. You might be having an ectopic pregnancy that grows outside the uterus, and also you might be having placenta problems. Number one placenta problem I've told you is a placenta detaching from the uterus, okay. That is risky to your baby because he or she can no longer get oxygen and also nutrients. An ectopic pregnancy is maybe the baby grows in the fallopian tube, and as the baby continues to grow, the fallopian tube is not able to stretch. It's not like the uterus. The uterus is made in a way that as the baby grows, it also stretches to accommodate the baby. And so when the baby grows outside, let's say it grows in the fallopian tube, the tubes are not able to expand. So at some point they will just rupture. And one of the signs of a ruptured ectopic pregnancy is vaginal bleeding and also abdominal pains, okay. A miscarriage is also another sign of vaginal bleeding, and you are also required to rush to the hospital so that you can get help. Another danger sign is breaking of fluid. Maybe you are in your daily, you're doing some activity, and then all of a sudden a fluid just breaks and flows through your vagina before your baby is term, okay. You are required to rush to the hospital. You might be going into labor, okay. When the fluid breaks, maybe if you are term, even if your baby is term, when the fluid breaks, rush to the hospital because you are going into labor. If the fluid breaks before term, that is called premature breaking of the membranes. You are also required to go to the hospital if your baby is not term, so that you can be monitored closely, because if the water breaks and the baby is not term, your doctor will need to do an ultrasound to monitor if your baby is still okay, because the baby has to be surrounded by the amniotic fluid. So you are needed to be monitored closely okay, to monitor the amount of the amniotic fluid that is remaining in the amniotic sac. And the doctor will know if you will need to go for an emergency CS, or also if you are not going into labor, you are needed to start on antibiotics to help prevent your baby from getting infections. Okay. Another danger sign during pregnancy is decreased fetal movements. Okay. Decreased fetal movements. Most ladies, by the time your baby is 20 weeks old, by that time you start perceiving fetal movements or kicks or baby kicks. By the time the baby is 20 weeks. For new moms, it might delay. You might start feeling the kicks between 20 to 22 weeks, but for old moms, you can start feeling the fetal kicks as early as 20 weeks. As early as 16 weeks. Okay, so you are required to monitor your baby's fetal kicks as the baby grows. As he grows, he will be more active, and the standard kicks within 1 hour, your baby should kick 10 times. Okay, within 1 hour the baby is supposed to kick up to 10 times. But if you don't feel the kicks, do not tense. You are required. You can stand up and go for a walk, or you can take something. You can take a juice, or you can start doing an activity, or the baby might be sleeping, so you don't have to tense. Just monitor and see if your baby starts being active. Okay. Another sign is swollen legs or face. Swollen legs or face is a sign that you might you have preeclampsia. Preeclampsia, that means your blood pressure is dangerously high, very dangerous. You are at a risk, and also your baby is at a risk. So if you notice that you start having swollen face, swollen limbs, okay, you need to go to the hospital to check your blood pressure, because you might be going into a condition we call eclampsia, which is so risky. Some ladies have lost their babies because of high blood pressure. So please be very keen and be very cautious. Okay, another thing is severe vomiting. Vomiting in pregnancy to some ladies is something normal. Morning sickness, you wake up in the morning feeling so nauseated or nauseated throughout the day. But the moment you vomit severely, you are not retaining anything. Completely, you are not retaining anything. Okay. You will lose electrolytes. That means you will be dehydrated, and also your blood pressure will be low. Your weight, you will have weight loss, and also you will have headaches. So you need to go to the hospital for hospitalization, so that you can be given fluids to maintain your blood pressure at a normal range, and also to replace the lost electrolytes. And also you will be required to change your diet if you are losing weight. Okay. And also for rest. Okay. Yes. So if you are severely vomiting, please do not stay at home. Make sure you visit the hospital. Okay. We have frequent urination. I understand during pregnancy, you will be running to the toilet more often, okay, because the growing baby is pressing on the bladder. But if you are excessively urinating frequently, you might be going into gestational diabetes. This is diabetes that occurs during pregnancy. Okay, you have been having you have not been having diabetes, but during pregnancy you develop diabetes, and this is what we call gestational diabetes. Okay, and one of its signs is frequent urination and also excess thirsting. Okay, another danger sign is fever. Fever is a sign of an infection. You're required to rush to the hospital for treatment. Another sign is chest pains. Chest pains can be a sign of preeclampsia, very high blood pressures, and also you might be having a pulmonary emboli. We have seizures. Okay, seizures. There are those epileptic women. During pregnancy, your seizures might be uncontrolled because of the pregnancy hormones, and you might notice that during pregnancy you have more seizures than before, or than when you are not pregnant. So you are required to visit your doctor so that they can know how to adjust the doses, because having convulsions during pregnancy is very risky to the baby, because it can deprive the baby of getting oxygen, okay, which is risky. And then another cause of convulsions during pregnancy is high blood pressure. So make sure you visit the hospital so that the doctor can evaluate and know if you're epileptic. They will adjust the doses. If it's high blood pressure, you are supposed to be started on hypertensive medications. Okay, yes, those are the 14 signs of danger signs in pregnancy. And please, if you notice one, just rush to the hospital, because you are having an issue that needs to be solved, like immediate. It needs immediate attention. And also, this is this one is getting you to, you are at risk, and also the baby is at risk. Okay, so thank you so much for watching, and I hope that you will be more keen. Pregnancy it can be a smooth journey, and it can also be so bumpy. But at the end of the 9 months, you will be the happiest person when you receive a healthy baby, and you will be grateful. Okay, so thank you so much for watching this. And also, if you have any question you need to ask anytime you visit the hospital, ask all those questions that you have, and we will walk with you through this journey of pregnancy. So what you need to do, just go to my YouTube channel and subscribe. You will get to watch the pregnancy journey. There are so many videos there you need to watch. And also, if you have a question, just ask down there in the comment section. I will try to answer you in my level best. Thank you.